Bismillahirrahmanirrahim. The model demonstration of pharyngeal arches. The transverse section to the upper part of the embryo. This area represents the prosencephalon. The prosencephalon. These are the optic vesicles. The optic vesicles. And this is the ophthalmic nerve. The ophthalmic nerve. Right one and left one. This is the maxillary process. The maxillary process. And this is the maxillary nerve. Right one and left one. Now the real pharyngeal arches. This is the 6th pharyngeal arch, 8th, 10th and 12th pharyngeal arches. 6th pharyngeal arch has mandibular division of the trigeminal nerve. The 8th pharyngeal arch has facial nerve. 10th pharyngeal arch has glossopharyngeal nerve. The glossopharyngeal nerve. First pharyngeal arch, mandibular division, trigeminal nerve. Second pharyngeal arch, facial nerve. Third pharyngeal arch, glossopharyngeal nerve. The fourth pharyngeal arch has superior laryngeal nerve and the recurrent laryngeal nerve. This is probably the superior laryngeal nerve. Okay, these are the grooves and these are the pouches, the pharyngeal pouches, and this region between groove and pouch is the pharyngeal membrane. The pharyngeal membrane. This is the mesoderm of the first pharyngeal arch, the mesoderm of the second pharyngeal arch, and so on. These develop into lateral lingual swellings. This whole area represents the floor of the primordial pharynx. The floor of the primordial pharynx. These develop into the lateral lingual swellings. There is a medial lingual swelling, and beneath it, the medial lingual swelling is also known as tuberculum impar. A tuberculum impar, and beneath it, we've also got a foramen cecum. Foramen cecum. This is either the hypopharyngeal eminence or the copula. Hypopharyngeal eminence or the copula. This is the tracheal groove which grows as a tracheal groove, and this is the esophagus. The esophagus. This represents probably the myotome. This is the myotome. This is also myotome. This is the developing vertebral column. And this is the notochord. The notochord. And this is the neural tube. The neural tube. On the sides we have got epicardial ridge, and the cervical sinus. The cervical sinus. This is the pericardial cavity. Pericardial cavity. The pericardio-pleural membrane. The pericardio-pleural membrane. This is the lung bud. The lung bud. The right lung bud and the left lung bud. And this is the pleural cavity. The pleural cavity. we've got these structures on the right side as well, the right side and the left side. And here we also have a pleuroperitoneal canal. I'm not sure the exact position, but the pleuroperitoneal canal is also somewhere over here, and this might be the dorsal aorta. And this is either the superior vena cava or the sinus venosus. Superior vena cava or the sinus venosus. Esophagus. So I guess that's it. If any mistakes, I apologize. Thank you.
Number 1 is prosencephalon. Number 2, अच्छा वो कहाँ गई वो लड़की? मुझे से अच्छा ये है. अच्छा prosencephalon, optic vesicles. These two are optic nerves. These two are maxillary process and within them are maxillary nerves. ठीक है? Which branch of trigeminal. फिर हमारे पास first pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch, separated by pouches inside and grooves on the outside. ठीक है? These are the endodermal lining of the first arch, of the second arch, of the third arch, and the fourth arch. और जो grooves है ये pouches है. ठीक है? ये जिनमें depression से हैं. अच्छा फिर इसमें जो artery ये mandibular nerve है इसमें. सेकेंड में फेशियल नर्व है, थर्ड में ग्लॉसोफेरेंजियल और फोर्थ में सुपीरियर लेरेंजियल नर्व ऑफ वेगस. यहाँ पे ये वाला 13 जो पॉइंट है, दिस इज ट्यूबरकुलम इम्पार. देन वी हैव हाइपोब्रेंकियल एमिनेंस. 22 इज ट्रेकियल ग्रूव. ये इसोफेगस है. ठीक है? फिर नीचे आ जाओ. न्यूरल ट्यूब in front of which is notochord. This hole is the stomate which is divided into sclerotome, myotome. ठीक है? These two are the pericardio-peritoneal canals. Within them, arising from the gut, जो कि इसके आगे के पार्ट से आए होते हैं, lung buds. ठीक है? Anterior, ventral to the lung buds are the pleuropericardial membranes, and dorsal to the lung buds are the pleuroperitoneal membranes. This is epicardial ridge, and this should be cervical sinus.
Of the brain, it's at the 4th week, 6th week, 7th week, 8th, and this 9th week. Just the 5 number structure is the insular cortex. The 6th one is the cerebellum. 7 number is the medulla oblongata. Now come to this model. 5 insular cortex. 2 number the lateral sulcus, Salvian sulcus. 6 number cerebellum. Salvian sulcus. 6 number the cerebellum and 7 number the medulla oblongata. Now this 5 number is insular cortex. 4 the lobe of the temporal
pole of the
temporal lobe. This the 11 number is the actual temporal lobe. The 3 number is the superior temporal fissure. The 2 number is the lateral sulcus. The 1 number is the central sulcus. The 9 number is the parietal lobe. The 8 one is the frontal lobe. The 10 one is the occipital lobe. The 6 one is the cerebellum. And 9 7 not brainstem medulla oblongata. Frontal lobe. 11 number temporal lobe, 9 parietal, 10 occipital, 1 central sulcus, 6 cerebellum, 7 medulla oblongata, 3 superior temporal fissure, and 4 number it is the pole of the temporal lobe.
Bismillah ar-Rahman ar-Rahim. The model demonstration of the development of the nervous system and the cranial nerves. So we start with the first model. This is the forebrain, the midbrain, the hindbrain. This is the auditory pit, which develops into the auditory vesicle. This is the fifth cranial nerve. This is where the fifth cranial nerve will develop. And this region represents the region of development of the 7th and the 8th cranial nerves. The optic vesicle, the 9th cranial nerve, region of the 9th cranial nerve. and the region of the 10th cranial nerve. The 10th cranial nerve. Spinal cord, heart, first pharyngeal arch, also known as mandibular arch, second pharyngeal arch, also known as hyoid arch. Next model. Okay, now this is the forebrain developed into the telencephalon. This is the telencephalon. Again, the optic vesicle. Forebrain is developed into the telencephalon and the diencephalon. Diencephalon. The midbrain, hindbrain. Hindbrain. Impression of the fifth cranial nerve. Development of the fifth cranial nerve. The seventh and the eighth cranial nerves. Seventh and the eighth cranial nerves. The ninth cranial nerve. Ninth cranial nerve. The 10th cranial nerve. 10th cranial nerve. The auditory vesicle. Spinal cord. Next. Further development. This is the telencephalon. Telencephalon vesicle. The eye. In the process of developing. This is the diencephalon. The midbrain. The hindbrain. This region represents the midbrain flexure. The midbrain flexure. This is the pontine flexure. The pontine flexure. And this is the hindbrain flexure. Hindbrain flexure. Hindbrain. Yeah, this is the trigeminal ganglion developing. Trigeminal ganglion. Giving off ophthalmic nerve, maxillary nerve, mandibular nerve. The auditory vesicle. Auditory vesicle. The seventh cranial nerve. Seventh cranial nerve. The ninth cranial nerve. The 10th cranial nerve. This is the 12th cranial nerve, the hypoglossal. Mandibular arch, hyoid arch. Again, telencephalon, optic vesicle, diencephalon, midbrain, hindbrain, and this structure, it's a bit confusing. Yeah, it's called the rhombic lip. I don't know what it means, rhombic lip. This is the myelencephalon. Myelencephalon. The trigeminal ganglion, giving 3 divisions. This is the auditory vesicle. Auditory vesicle. Opposite auditory vesicle. This is the 9th cranial nerve again. 9th cranial nerve. The 10th cranial nerve. The 12th cranial nerve. The 7th cranial nerve. 7th cranial nerve. Next one. This is the fully developed cerebral hemisphere, developed from the telencephalon. Cerebral hemisphere. The olfactory lobe or bulb. The olfactory lobe. The optic chiasma. Optic chiasma. Diencephalon. The mesencephalon, midbrain, having the superior colliculus and the inferior colliculus. The cerebellum, the medulla. Trigeminal nerve, ophthalmic, maxillary, mandibular. The spinal cord. The 7th cranial nerve. 7th cranial nerve. And this is the chorda tympani branch. The chorda tympani branch of the 7th cranial nerve, the facial nerve. This is the 9th cranial nerve. The 10th cranial nerve. The 12th cranial nerve. So this was about the development of the nervous system. Thank you.
जाना ऊपर करो, बस डायरेक्ट बोल लेता हूँ. 1 notochord, 2 dorsal aorta, 3 is the posterior cardinal vein. 4 is the mesonephric duct. This 5 mesonephric glomerulus. 6 is the germinal epithelium. 7 midgut, and 8 umbilical cord.
trunk splenium of corpus callosum.
ये सेप्टम पेलुसिडम, ये हमारे पास हाइपोथैलेमस, हाइपोफिजियल स्टॉक, पिट्यूटरी ग्लैंड एंड स्टॉर्स इन व्हाट हाइपोफिजियल फोसा,
और ये पूरा
सेलेटर का ये हमारे पास थैलेमस इन द थर्ड वेंट्रिकल इज कंटिन्यूअस टू द फोर्थ वेंट्रिकल थ्रू द aqueduct. दिस इज pons, medulla, cerebellum, ये पिनियल बॉडी, हाँ पिनियल बॉडी, और मिड ब्रेन है ना. अच्छा, ये हमारे पास है सेजिटल साइनस, सुपीरियर सेजिटल साइनस, ये इंफीरियर सेजिटल साइनस, ये हमारे पास स्ट्रेट साइनस और ग्रेटर सेरेब्रल वेन से फिर यहाँ पर कॉन्फ्लुएंस ऑफ साइनस है ये. अच्छा, फिर यहाँ पे आओ, ये फ्रंटल साइनस, ये स्फिनोइडल साइनस, ये नोज सुपीरियर कॉन्का, मिडिल इंफीरियर कॉन्का, ये सुपीरियर मिएटस, मिडिल मिएटस, इंफीरियर मिएटस.
और ये रेसेस कौन सा है? रिसेस
उसको छोड़ो, ये हमारे पास हार्ड पैलेट, सॉफ्ट पैलेट. फिर ये टंग पूरा, टंग का जूनियोग्लोसस और जूनियोहाइलाइट मसल ये है. फिर ये यहाँ से लेकर यहाँ तक नेजोफेरिंग्स है, यहाँ से ओरोफेरिंग्स, यहाँ से फिर एसोफेगस,
कंटिन्यू इनटू दैट.
जी
मैम
सर.
मांग रहे हैं.
अच्छा, नंबर 1 पेरिकार्डियम, नंबर 2 पेरिकार्डियल कैविटी. अच्छा, नंबर 1 पेरिकार्डियम, नंबर 2 पेरिकार्डियल कैविटी. यहाँ पे लंग बट डिवेलप होता है, उसके आगे प्लूरो पेरिकार्डियल मेम्ब्रेन और इसके पीछे प्लूरो पेरिटोनियल मेम्ब्रेन. दिस इज़ द पेरिटोनियल कैविटी, ठीक है. और बाकी ये लिवर है, बस इसमें तो और कुछ नहीं.
नंबर 1 इज पेरिकार्डियम
हाँ.
और नंबर 2 इज पेरिकार्डियल मेम्ब्रेन
कैविटी
सॉरी.
कैविटी स्पेशल, ठीक है.
ओके मैं बस रिलैक्स का.
We studying the model of the
Body
embryo, and these are the body cavities.
Right.
And this number 1 cavity, this is known as the pericardial cavity, and number 2, this structure, this is called the pulmonary ridge, the pleuropericardial membrane, and number 3 is the pleuroperitoneal membrane. Actually, these are this is the canal. This is the canal, and this canal is known as pleuroperitoneal canal.
Pericardio-peritoneal canal.
Pericardio-peritoneal canal. Sorry, this canal is pericardio-peritoneal canal, and this inferior structure number 8. This is known as the peritoneal cavity. This reddish structure, this is the liver, and this is most probably the foregut or stomach. And this is the primordium diaphragm, and known as septum transversum.
Sinus venosus.
And number 4 structure, sinus venosus. This is the sinus venosus, number 4 structure. Now here it is a little bit developed. This is the pericardial cavity, and this cavity is the pleural cavity, and this is the pleuropericardial membrane, and this separates the pericardial cavity from the pleural cavity. This is the peritoneal cavity, and this is a ridge which separates it from the pericardial and pleural cavity. This ridge is known as pleuroperitoneal membrane. This red structure is the liver, and this is the stomach or foregut, and this number 5 is the common cardinal veins. And this number 8 is the suprarenal
structure, not concerned.
Not concerned.
This is 6 is the septum transversum.
6?
6.
Yes, this is the septum transversum.
Yes.
Okay. As we see, this is the pericardial cavity, this is the pleural cavity, and this is the peritoneal cavity. This is the pleural pericardial membrane, and this is the pleuroperitoneal membrane.
Pleuroperitoneal.
Pleuroperitoneal membrane. This is the liver, This is the foregut or stomach. This number 8 is suprarenal structure, and this is the septum transversum. This is the common cardinal vein, and we are done with this one.
Thank you.